Acne, of course, is a problem that many people think they will not deal with as an adult.
Tonight, in a 7 News exclusive report, health reporter Janet Wu gives us a sneak peek at a new breakout breakthrough.
You've tried it all, creams, facials, even the pill, but your acne is still winning the face wars. Well, you're not alone. Thousands of people fight the tough fight every day. Tara Mioli is one of them.
It's more or less just being comfortable with who I am, being able to go out without feeling embarrassed.
As a college student here in Boston, Tara says stress and a not-so-great student diet can be tough. Exams,
tests, papers, I do tend to flare up a little bit.
So what's a woman to do? How about zapping that acne away?
With this laser, with minimal side effects, minimal downtime, people can have the treatment and really get long-term remission from their acne.
The new acne laser is being tested here in Boston. It works by first spraying a cool mist to protect the skin.
Let me know if you need to take a break.
Then the light zaps below the surface to shrink the sebaceous glands, cutting off future breakouts.
Last one.
It takes roughly 3 to 5 sessions, spaced 1 month apart, to treat the acne. Because testing of this therapy is so new, the results vary. But one study shows the laser can reduce acne for up to 6 months.
Some people may respond very quickly and very well to it. Others, it may take more treatments. Will it go longer than that? Probably. How long, we can't say for sure. It's really in its infancy. It's a tough area.
Because the face is a sensitive area, there is some discomfort with the laser.
We liken it to like a rubber band snapping or someone doing that to the skin. So it's not enjoyable, but it's usually tolerable.
But for women, it may be a good alternative. Medication like Accutane can be very effective in fighting acne, but it can carry serious side effects like birth defects. For Tara, she's already made her second laser appointment.
That's it. And what we'll do is just bring you back in a month and do the same thing again.
He treated about 3 or 4 areas, and it didn't take all that long. I was first. I definitely feel that it worked.
Patients should expect a little red in the treated areas, but it goes away in a day or so. This same laser has already been FDA approved for acne scars and wrinkles, but still awaiting approval for use on acne.
And on the Health Beat, see how a local dermatologist is using a new method to treat acne.
All right, coming up on New England's News Center 5, how a local doctor is getting encouraging results with a new treatment for acne. That is today's Health Beat report. On the Health Beat today, millions of Americans suffer from acne. It can be disfiguring and take a toll on self-esteem. And now a local dermatologist is experimenting with a new technique that shows real promise in treating even the most stubborn acne. News Center 5's medical reporter Heather Unruh is on the Health Beat.
Our patient had acne on both sides of the back that was equal. And we did a little test area right through here. You can see even a month later, there's a couple of, acne lesions there, but the majority of them have cleared out.
Now Dr. Tom Rohr is treating her entire back and shoulder area with the smooth beam laser, FDA approved to treat wrinkles, but not yet acne.
And what this is doing is just heating the sebaceous glands and shrinking them down. And it's the sebaceous glands that are largely responsible for the acne.
The tiny pulses heat just beneath the skin's surface.
Hanging in there?
Numbing cream dulls but doesn't eliminate the hard, pinching pain.
What the laser tries to do to help it hurt less and to protect the top layer of skin is it puts a little spray, a cryogen spray, which cools the surface of the skin down, protects it, and helps with the pain. But it's still going to hurt.
The procedure and pain last only minutes and may be worth it. Rohr says a California researcher followed 17 patients with stubborn back acne through 4 treatments in as many months with impressive results.
And what he found, even 6 months after the last treatment, that of those 17 patients, 16 had no acne lesions, and 1 patient had 2. And so it was a 98% reduction in the acne lesions.
All at a cost of $400 to $800, not covered by insurance.
When lasers are involved, there is always a risk of scarring, but Dr. Rohr says it's very small and he hasn't seen any problems so far. In fact, he says the new laser shows real promise in improving acne scarring.
Getting a facial used to mean walking into a spa for an hour-long procedure that left you red and blotchy in the name of beauty. Well, now many doctors' offices are offering the medical equivalent of spa therapy for your skin. Joanne Simonata takes a trip every few weeks to the Juva Skin and Laser Center. She's getting her face zapped.
you're just going to feel a little zapping sensation, just like a little small, like a rubber band snapping against the skin. That's basically it. And you'll be a little red, maybe a little slightly swollen for a few hours after.
Dr. Bruce Katz is using a new laser technique to get rid of years of sun damage.
So what we do is we are applying the laser to the skin where Joanne has the lines around her eyes. And there's a little spray here that comes out. That actually chills the skin before the laser light impacts it. So it cools the upper layer so that the laser can penetrate deeply into the dermis.
It feels great, Doctor.
See, it's pretty easy, eh?
Joining me now, the patient you saw at the beginning of our story, Joanne Simonata, and her doctor, Bruce Katz. Welcome, both of you. I saw you when you walked in, and you did have a little sun damage. You look amazing, almost 10 years younger. How do you feel?
I feel great. Actually, the procedure is very comfortable. It's just going in, actually just feels like you're going in for a facial. It's like a snap of a rubber band, no downside.
No pain.
No pain. And the results are amazing.
And doctor, you say it's used by a light sensor.
Yes, actually, it's a laser light that penetrates into the dermis and stimulates new collagen. So this very quickly causes new collagen to develop, tightens the skin, takes away the wrinkles, lightens sunspots, takes away broken blood vessels, and really gives significant improvement, but with no downtime.
There are different kinds of lasers now used on the face.
Yes, we're actually using the newest technology, which is called the smooth beam. And this penetrates most deeply and gives you the fastest results in our experience.
Now, I know that there is microdermabrasion, macrodermabrasion, which we saw part of in that salt peel here, and also the laser. What's the difference between these?
Well, microdermabrasion is a fine crystal that is gently abraded against the skin. So this will take away fine lines, but the problem is that it doesn't stimulate new collagen and give you lasting results. People like the benefits, but they're more temporary.
Okay, now let's talk about the cost of the laser surgery.
Well, it varies depending upon the part of the country, anywhere from $400 to $700 a treatment.
And you had 3 treatments.
Yes.
It's expensive. Was it worth it?
Absolutely.
You look amazing again.
Thank you
Thank
very
you
much.
so much for being with us. And of course, we can find more information on Dr. Katz and any of these procedures for doctors if you call our hotline. Or just check out the Juva Center or the other doctor in the piece, Dr. Victor, and also our other doctor in the piece, which you can find on our website, Dr. Dennis.